Imagine being in your 60s or 70s. You just lost your lifelong partner. Or maybe you're going through a painful divorce. The grief is overwhelming. And then suddenly, you feel this crushing pain in your chest. You can't breathe. You rush to the ER, fearing a heart attack. But what the doctors tell you next is shocking. Your arteries are clear. Your heart's not blocked. It's broken. This is not a poetic metaphor. This is a medically recognized condition called broken heart syndrome, or Takotsubo cardiomyopathy. And make no mistake, this syndrome is silently affecting thousands of older adults in the US, Europe, and all across the Americas. Often misdiagnosed, often misunderstood, and tragically, often fatal in senior men who rarely speak about their pain. What is broken heart syndrome? Broken heart syndrome, also called Takotsubo cardiomyopathy, gets its name from a Japanese octopus trap because that's exactly what the heart looks like during an episode. Part of it balloons out, but it's not clogged arteries causing this. No, it's your own body, overwhelmed with adrenaline, refusing to let the heart contract properly. This isn't a minor condition. In some seniors, it leads to congestive heart failure or even death. Why men die twice as often. Here's the chilling part. While women are diagnosed with broken heart syndrome more often, men, especially older men, die from it at twice the rate. A massive US study analyzing over 200,000 cases showed that 11% of men with this syndrome died, compared to only 5% of women. The reason? Men usually experience this after physical trauma like surgery or a stroke. Women, however, are often triggered by emotional losses, which tend to be less deadly. Plus, men rarely have the social support system that helps them recover from stress. What really triggers it? You might think broken heart syndrome only happens after death or divorce. But doctors have found it can be caused by surprisingly small stressors. A heated argument, a minor surgery, even a stomach bug that causes vomiting. It's not always the size of the stress, but how your body responds to it. Some people are just more biologically sensitive. If you already have high blood pressure, high cholesterol, or are postmenopausal, your risk goes way up. Who's at risk? If you're over 60, recently widowed, recovering from surgery, or living alone, pay attention. You are in a high-risk category for broken heart syndrome, especially if you live in the US, Canada, or Europe, where emotional stress and chronic diseases are common in older populations. Women are more frequently diagnosed, but older men, especially those who downplay their feelings, are dying quietly, their pain mistaken for weakness. Symptoms to watch for: chest pain, shortness of breath, dizziness, palpitations, sweating, nausea. These aren't just signs of a heart attack. They're also symptoms of broken heart syndrome. But here's the problem. You can't tell the difference at home. You need an EKG, an echocardiogram, and a specialist to confirm it. Never assume it's just stress. Go to the hospital immediately. Treatment: why we're still guessing. There's no miracle pill for broken heart syndrome. Doctors use beta blockers, ACE inhibitors, and diuretics to support recovery. But medications alone aren't enough. The real cure? Reducing emotional stress through therapy, meditation, support groups. But even with these interventions, mortality hasn't improved much since 2016. We're still in the dark. Can it be prevented? Prevention starts at home with your lifestyle. Walk daily, eat heart-healthy foods, practice mindfulness, and most importantly, don't isolate yourself. Stay connected, join a local club, talk to friends, call your kids. Every small connection adds protection for your heart. What the future holds. Researchers are finally asking the right questions. Is it hormone loss in postmenopausal women? Is it hidden genetic factors? Is it microvascular dysfunction? They're exploring better diagnostics, targeted therapies, and early warning systems. But for now, the condition remains an unsolved mystery. And in that mystery, many lives hang in the balance. Final words. Listen to your heart. If you've been through heartbreak, loss, or life-shaking stress, your heart feels it. And sometimes it breaks. But here's the hope. Broken heart syndrome is treatable, survivable, preventable. The key is to listen. Don't ignore your pain. Don't dismiss your symptoms. Don't wait. Whether you're in Miami, Manchester, or Munich, when your heart speaks, listen. If this video opened your eyes to something you didn't know before, don't keep it to yourself. Share it with someone you care about. Your father, your aunt, your friend from church, someone out there is silently suffering, and this knowledge might just save their life. Tap the like button if this message mattered to you. Darling, please hit subscribe, heartfelt love, for more life-saving health insights, especially made for seniors in America, Europe, and across the world. And don't forget to turn on the bell so you never miss a video that could change or even save your life. Your heart matters, your health matters, and you are not alone.